Myself, Dr. Sumit Agrawal. I'm consultant plastic surgeon practicing in Harleys clinic in Mumbai and Dubai. Today we are demonstrating a PRP procedure, platelet-rich plasma procedure for hair restoration. In this patient, he's having thinning over the crown and the mid scalp. So for which we are doing plasma procedure for him. I prefer to start doing micro needling with derma roller before injecting the plasma, as it helps in releasing epithelial growth factors, which helps in giving better results with the plasma therapy. As you can see, the procedure is quite well tolerated under local anesthesia. Injecting plasma, as you can see, the depth of the needle injection should be approximately around 4 mm depth to get the maximum results of the plasma, because the hair follicles are at the depth of around 4 mm from the skin surface. So to get the best result, the needle should be injected half into the skin, and the pricks should be at approximately 1 cm distance to get an even result from the injections. As you can see, since the needles are at the correct depth, there is no oozing from the puncture marks, from the puncture points. If the injection depth is deep, the plasma will get wasted. It will go into the subcutaneous tissue, and you will notice more bleeding with the pricks, which is a red sign. This plasma, when injected into the dermis, it releases multiple growth factors like vascular endothelial growth factor, epithelial growth factor, angiogenic growth factors. These growth factors then stimulate the growth in the dormant lying hair follicles and improve their thickness and length. So you can again notice the depth of the injection. The plasma should be injected at a proper depth to get the best results. You can see blanching on the skin, which is again a sign of a proper depth of plasma injection.